Fluorouracil. Metabolism. Fluorouracil is an anti-metabolite fluoropyrimide analog of the nucleoside pyrimidine with antineoplastic activity. Fluorouracil and its metabolites possess a number of different mechanisms of action. In vivo, fluorouracil is converted to the active metabolite 5-fluoroxidine monophosphate, replacing uracil. FUMP incorporates into RNA and inhibits RNA processing, thereby inhibiting cell growth. Another active metabolite, 5,5-fluoro-2-deoxyuridine 5-O monophosphate, inhibits thymidylate synthase, resulting in the depletion of thiamide triphosphate, one of the 4 nucleotide triphosphates used in the in vivo synthesis of DNA. Fluorouracil is a nucleoside metabolic inhibitor. The mechanism of action of fluorouracil is as a nucleic acid synthesis inhibitor. Fluorouracil is a pyrimidine analog used as an anti-neoplastic agent to treat multiple solid tumors, including colon, rectal, breast, gastric, pancreatic, ovarian, bladder, and liver cancer. Fluorouracil is associated with a low rate of transient serum aminotransferase elevations during therapy and has been implicated in rare cases of clinically apparent acute liver disease. Anti-metabolite drugs work by inhibiting essential biosynthetic processes or by being incorporated into macromolecules such as DNA and RNA and inhibiting their normal function. The fluoropyrimidine and 5-fluorouracil does both. Fluoropyrimidines were developed in the 1950s following the observation that rat hepatomas use the pyrimidine uracil, one of the 4 bases found in RNA, more rapidly than normal tissues, indicating that uracil metabolism was a potential target for anti-metabolic chemotherapy. The mechanism of cytotoxicity, 5-FU, has been ascribed to the misincorporation of fluoronucleotides into RNA and DNA, and to the inhibition of the nucleotide synthetic enzyme thiamidylate synthase. 5-FU is widely used in the treatment of a range of cancers. Although 5-FU in combination with other chemotherapeutic agents improves response rates and survival in breast, head, and neck cancers, it is in colorectal cancer that 5-FU has had the greatest impact. 5-FU-based chemotherapy improves overall and disease-free survival rates of patients with resected stage 3 colorectal cancer. Nonetheless, response rates for 5-FU-based chemotherapy as a first-line treatment for advanced colorectal treatment are only 10 to 15%. The combination of 5-FU with newer chemotherapies such as iridectin and oxaliplatin has improved the response rates for advanced colorectal cancer to 40 to 50%. However, despite these improvements, new therapeutic strategies are urgently needed. 5-FU is an analog of uracil with fluorine atom at the C5 position in place of hydrogen. It rapidly enters the cell using the same facilitated transport mechanism as uracil. 5-FU is converted intracellularly to several active metabolites. These active metabolites disrupt RNA synthesis and the action of TS. The rate-limiting enzyme in 5-FU catabolism is dihydropyrimidine dehydrogenase, which converts 5-FU to DHFU. More than 80% of administered 5-FU is normally catabolized primarily in the liver, where DPD is abundantly expressed. In summary, the fluoramidine 5-fluorouracil is an anti-metabolite drug that is widely used for the treatment of cancer, particularly of colorectal cancer. 5-FU exerts its anti-cancer effects through inhibition of TS and incorporation of its metabolites into RNA and DNA. Modulation strategies such as co-treatment with leucorvin or methotrexate have been developed to increase the anti-cancer activity of 5-FU. Molecular biomarkers that predict tumor sensitivity to 5-FU have been identified, including mRNA and protein expression levels of TS. DNA microarray analysis of 5-FU responsive genes will greatly facilitate